If you can, get a certified diabetes care and education specialist for diabetes education and support. Now, this is something I want everybody to hear. If you have diabetes, you need some diabetes education. 90% of the people, more than just what you get inside your primary care clinician's office. You need to understand what's going on with the diabetes. You need to understand what kind of diabetes you have, how to take care of it, what you're doing that may be right, what you're doing that may be wrong, what do you need to look out for. And all this stuff is covered on the diabetes education. So if your numbers are not absolutely pristine, you need to go for diabetes education. If you're listening to me now and you have a diagnosis of diabetes and you don't know what a hemoglobin A1C is, you need diabetes education. Okay. Somebody needs to refer you for diabetes education. You need to understand what you have. You need to understand this condition because I've seen way too many people from my clinical experience that have diabetes that's not completely controlled and they have never seen a diabetes educator. And I'm telling them stuff that's completely new to them. And of course, by the time they're seeing me, it's because they got kidney disease from the diabetes. So you need to make sure that your loved ones, that is something that you're taking care of. They can help you, like I said, if you're taking insulin, they can help you with carb counting, learning how much insulin you give for your carb. They can tell you what foods are good, what foods are bad. You can get some of those questions answered. So make sure you're getting that diabetes education and support. Okay. So then you want a dietitian or nutritionist, and this is kind of complementary to diabetes care. Some of these diabetes educators kind of do a lot of dietitian work. Sometimes we just send them to a dietitian or nutritionist separately, especially if they have other comorbidities like they got for me. Of course, I'm seeing a lot of people with kidney disease. So sometimes, I want them to be seen by diabetes care. And then I also want them to see a dietitian to kind of help work with the chronic kidney disease in there. So sometimes you need both of them. And then you have other folks that are on there, your pharmacist that's going to help you with your question about some medications. Dentists, everybody needs to get some regular dental care as well. And sometimes because you have these multiple comorbidities, some people get a little depressed and anxious. So make sure you have a mental health professional. Go talk to a counselor if you need that. Make sure you got plenty of support from that standpoint. Also, community health workers or health coaches can also be very important as well. So these are all the people you can add to your diabetes care team. Now, as things go on, you may need some other specialists like a nephrologist. Oh, that's me. Or a heart specialist, depending on what's going on with you. Make sure you're getting the specialty care, so especially if you have trouble getting your blood sugar under control despite medications. And it's also if there are any signs of complications, then you want to make sure that you're being seen by specialists, and especially with vision changes, numbness and occurring sores, frequent low blood sugars, anything that's just not usual. I always ask for specialty referrals. If you're pregnant with diabetes either before or someone tells you got blood sugar that's high, make sure you're being seen by the right person because gestational diabetes can lead to complications for the mother and for the child. If you got advanced kidney disease, high risk for kidney failure, then like I said, you want to be getting screened. That albumin test is especially important. Come to see a kidney specialist earlier rather than later.